Hello and welcome to our video series. In this episode, we'll be delving into the experiences and insights of another remarkable member of our team. This is Dennis. Please introduce yourself.
Hi, everyone. I'm Dennis Göhlsdorf. I'm a co-founder of Scailyte. I'm normally working as a machine learning engineer or data scientist, tweaking our models. But currently, I'm temporarily working as a director of data science, replacing Sarah Carl, who's on maternity leave.
What inspired you to, I would not say join Scailyte, but rather start Scailyte, and how has your role evolved since the beginning?
Well, I was contacted by a friend, Manfred Klaassen, about a year before Scailyte was founded. And he asked me to do whether I would be interested in doing business. And he showed me a paper to read. And I read through the paper and I found the idea quite appealing. So then he and Peter, they convinced me that there's a huge market need for what the paper is actually doing, the technology behind it. And that was quite appealing. And I really like the appeal of the idea of changing patients' lives, or actually having an impact, and not just writing software that people, improve their lives in a marginal way. And last but not least, of course, it promised to be an adventure, and it has not disappointed me so far. So I started originally as a software engineer for Scailyte. So I was leading the development of our software as a service. After a while, we decided to shut that service down. And since then, I became more of so now I'm writing less software, but more improving models and working on the AI behind. And that's actually even more interesting than my original role.
Thanks. I guess the perfect segue into the next question. Can you share a recent project or accomplishment that you're particularly proud of?
So we had a couple of new accomplishments for the platform that we're working on over the past year. Unfortunately, that's usually our inner IP, so I can't really share details about that. But I was lucky enough to drive some of these improvements, and that's actually making me quite proud. Overall, the whole traction of the platform is making me proud. What I can share is one thing that's currently motivating me is a project for automating tracking of data scientist actions while doing analysis. And when that's done, that should save our data scientists a lot of work in documenting while doing analysis in order to make them reproducible. And that's motivating me.
In your opinion, what sets Scailyte apart from other organizations in the field?
Yeah, that's always difficult to convince customers also, like, why is your AI better than someone else? Everyone's saying, oh, we're doing AI with biological data. And then customers never really understand, like, what is the difference? And also, frankly, I sometimes have problems understanding what other companies are offering when they say that they have AI. And so first of all, I'm pretty convinced of our methods. If I wasn't, then we would just replace the methods. It's just a few models that need to be replaced in the end. So I haven't seen anything that works better than what we do and is more interpretable than our algorithms. And second, one strength of Scailyte, I think, is that we're really transparent of what we do. So we can really introduce the algorithms. We can show we're ready to show the models and how the inner workings are, so people can really understand what we're doing. It's not just an abstract, we do AI on single cells. We can really have a meeting with us, and then we can explain the models behind it. And I think this is really good. And last but not least, we've been on the market for 6 years already. So our platform has developed quite a lot, and we gain a lot of experience. And one thing is to write this platform. The other thing is to actually have the people behind it. And I think just this team that has 6 years of experience is of incredible value, of course, for us, but also for customers.
Moving on to the final question, how do you envision the impact of Scailyte's work on the future of healthcare and diagnostics?
So I think in short term, we can have a true impact on, for example, clinical studies and making a difference in enabling precision medicine. For example, by differentiating patients before even applying a drug to them and identifying those that will respond to a drug. And there's a huge need and a huge gap. And with the long term, I still maintain that vision that all these single cell technologies will move from the lab to clinics, actually become much cheaper and widely available. And just thinking about the idea that single-cell RNA data, for example, would be available as a clinical diagnostic tool is still very appealing. It's not nowhere in reach right now, but say in 20 years, I think this is very much doable. And that would like lead to a completely new era of diagnostics. And I think Scailyte has very much potential to be in the forefront of that and leading towards new diagnostic procedures. And that's still a very appealing vision to me.
Thanks, Dennis. And I always like to finish off with a bonus question. What would you like to say to everyone watching? Maybe a statement, maybe a thought, maybe just you would like them to do something, maybe like a call to action.
Well, to anyone interested in single-cell analysis, what I usually say is, like you can go ahead and try the algorithms. You can read the papers and do that all by yourself, or you can choose not to and not spend years of understanding and getting into it, but rather you could also like schedule a call with us and just get to know our ideas and benefit from our experience.
Thanks a lot, Dennis, and thanks a lot, everyone, for watching.
Thank you, Khalil, and everyone else. Bye.